Welcome to a brand new edition of Skin Sense, Sina here on SSP TV. I'm Jeannine Mazurkiwecz, and we're with Dr. Steve Schleicher, and we have a guest today. We're going to be talking about laser procedures, and we hope that you stay tuned. We have 2 procedures today, right?
Absolutely, you're one of them.
I know, always the guinea pig when we don't have anyone,
yeah, you
right?
can tell how nervous she is. She's shaking. But she'll be fine. She'll be fine. We're going to remove some little tiny blood vessels.
Okay.
And she'll be a new person by the time we get done.
Blood vessel free.
Blood vessel free.
All right, and we have a special guest.
Right, we have a special guest, and let me preface our comments by saying that I'm on staff of the Commonwealth Medical College, okay, which is an up-and-coming school, one of the newest medical schools in the country. They have branches in Scranton, their main branch, but also in Wilkes-Barre and Williamsport.
Okay.
And we take their students on rotation, and Blake is one of their finest students. And it turns out he's interested in dermatology.
Nice.
So hopefully he will be a fellow dermatologist, maybe one day join me in my practice. Who knows?
All right. And,
who knows?
And did Blake know he was going to be on the show today, or did we just throw him into?
We kind of surprised him a little bit.
I love that.
But,
surprise.
He's used to surprises. But, you know, working around me, yeah, we have lots of surprises.
It's always impromptu.
It's always impromptu.
All right, so tell us
yeah.
about how long you've been here and what you're learning.
Yeah, so this is my 3rd year in medical school, and I've been here as part of the curriculum. We have white space, and you fill it with things you're interested in. And so I had an interest in dermatology, and so I came down here to Dr. Schleicher's office, and have been rotating basically the whole year, most times, you know, in the afternoons, and it's been a great experience. You never know what you're going to see. The field is diverse, and like you said, always full of surprises.
What is the most interesting thing that you've seen here working at the center?
Besides you?
Some of the interesting cases, you know, you see some pretty rare, you know, blistering diseases.
Lots of skin cancers.
Lots of skin cancers, and you know, the routine eczemas and acnes, and sometimes those are even challenging to treat as well.
Mm-hmm. What's like the craziest incident you've ever seen?
Here?
It's probably
Yeah.
probably has to deal with Doc doing something crazy.
Probably me eating lunch.
Yeah, I'm not sure what the craziest diagnosis we've made may be.
Well, we had a few. We had the nodular scabies, which is kind of cool. Okay, which
Is cool.
Yeah.
I know, and I just showed Blake a picture of a lady who came in with these skin lesions on her elbows and knees, and you know, we took one look at them, and here her triglycerides, which are the levels of fat, were so great they were coming out in her skin. So that's a medical emergency. And if you took a sample of her blood, instead of being red, it was milky and white.
Wow.
Yeah, and she's walking around like that. She was diabetic and she was a smoker, but she's this step away from getting a heart attack from having all that fat circulating in the bloodstream.
And you know, everyone obviously has skin, and you need to take care of your skin. So if there's anything that you see out of the ordinary, not just when you look in the mirror, like look underneath your arms, look behind your ears, have someone look behind your back, or use a mirror, you know, behind your legs.
So that's
these
one
are
thing,
areas that we need to look at.
Right, that's one thing Blake actually mentioned before, that, you know, it's really, skin is the mirror to the rest of your body. So you can pick up some of these systemic diseases just by looking at a person, just like when we, you know, looked at that person's arm. So, and then let me add too that Blake is going into the military. Wow. So, which is great. Maybe you could talk a little bit about future plans.
Yeah, I'm under scholarship through the Air Force. It's called the HPSP scholarship program. And so they pay for medical school, and after school, and I do my training as a resident, I serve as a physician in the Air Force. And so it's exciting, and I look forward to serving.
How is this experience, do you think, will help you in the military?
I mean, the military, just like any population, needs physicians of all different specialties, and so getting more exposure, especially to skin, which is you know, the biggest organ in the body, is definitely comforting, reassuring that I'll have that experience, you know, going forward.
Just say if you get sent to Afghanistan or Iraq, you might get this little parasite called Leishmaniasis.
That's his welcoming gift to you. Don't you get a parasite?
Nobody around here really. I actually have a patient with it who actually got it in Costa Rica.
Right.
Watching bird watching in Costa Rica, but we see it in servicemen who serve overseas in certain areas. So, or women, yes.
Or women out there.
Yes, no, that's true. But we're proud of Blake for serving our country. And, you know, I'm also kind of honored that he really likes dermatology and hopefully will enter the field. And he'd be an excellent dermatologist. So we've already co-authored a couple of papers.
Good.
So, yeah, we want to see him get into dermatology.
So is there any advice you want to offer anyone who wants to go into the field of dermatology?
Yeah, it's definitely a competitive field to get into. Definitely persevere. Definitely, you know, keep trying. Try to be exposed to as much dermatology as you can. You know, rotate with dermatologists. Try to write papers, and just be involved in the field. I think is especially important.
Good. Well, today we're doing the laser procedures. We have one with tattoos.
Correct.
And then one on blood vessels. What else can the lasers be used on?
Well, it can be used for a lot of things. Scarring, for instance. Today we did somebody with stretch marks. Okay, if you have red stretch marks, the laser will help take the redness out and make the stretch marks a lot less visible.
Okay.
Okay, so it's very versatile, and there are a number of lasers that are out there. You can use it for facial rejuvenation to remove fine lines and wrinkles. Okay, as well as what we just talked about, rosacea, which is a very common entity where people get these dilated blood vessels, very disfiguring from a cosmetic standpoint, and the best treatment out there is the laser.
All right, so when we come back, we have our first guest, Joe. He's from Schuylkill County here in Pennsylvania, and then I guess I'm the guinea pig for the end. So if you want to see crying, stick around for later in the show. But you are watching Skin Sense right here on SSP TV. We will be right back. And if you're just joining us here on Skin Sense, seen on SSP TV, we're talking about laser and different procedures you can do with the laser machine. And right now we're actually going to be getting rid of a unwanted tattoo with our special guest, Joe. And we're going to put on our magical glasses, right, to protect ourselves. And Blake is back with us. He's going to be talking about the laser machine. So again, we have some different procedures we can do with the laser. One is the removal of unwanted tattoos.
Absolutely. And this tattoo, I tell everybody, if you're going to get a tattoo, don't get green. Okay? Because green is, as Joe knows from experience, it's the toughest one to remove. And we've already worked on, this was dark black. We see a little bit of red left, but we see a lot of the green pigment. And unfortunately, the lasers that we have today just don't do that well with this particular aquamarine greens, very tough.
Okay.
So what we're going to do is we're going to treat the black areas and the red areas with the laser today. And then we're going to do a little test area with an electric instrument. So we're basically going to use electric current instead of laser, which is light, okay, to kind of, in a sense, pulverize this pigment. And you'll see both procedures today during the show.
Okay, let's do
So
it.
we're basically ready to trace this out. And again, we're doing the laser first. So I think as soon as that beeps, it's ready.
Now, how many procedures has Joe already gone through?
This had about 5 procedures, I think.
So again,
far.
if you're
So-
looking to get a tattoo, remember that it is permanent, number one, and number two, the removal is a process. It's not just one time and you're done.
And
Right, Joe?
That's correct.
Yeah, and you can see this cracking. This doesn't tickle, okay? It's like
Joe's like,
rubber
steel.
band. Yeah, Joe's a good patient, but it
Yeah,
doesn't
like little
tickle.
flicks of rubber band.
So, but that noise that you hear is actually the pigment being pulverized.
Right.
Okay, and then you see a little gas arising. That's CO2 being produced under the skin.
Now, are there different levels from this laser machine as far as the power behind this?
Absolutely, yeah. You can set the power depending on the pigment. And actually, in between, we'll set the pigment for the red. Okay, so we're doing the black now. And
Now,
then-
is this based on the tolerance level of the patient's pain
Well,
level?
you know what? Some
Because
people-
Joe's not even flinching. We've done some shows where people really, really have a hard time because there are different areas of your body that are more sensitive to this.
Yeah, Joe's a good patient.
How
So
you doing,
does it
Joe?
hurt?
It hurts to a degree. It
Yeah,
does.
yeah. I mean,
Great.
it doesn't tickle.
Well, I'd be crying, so.
You will be crying because
Oh, I
we're
will
gonna do
be
you.
crying.
We're gonna do you, but
I'm
now
not
you're
gonna be
tattooed.
crying.
Oh, I'm just kidding. We won't want to hurt you.
Yeah, later in the show, there's different procedures you could do with the laser machine. I actually have some, like a blood vessel on my face that we're gonna laser off. If you have any little blood vessels, I know with women, I mean, I got mine
we're
from
gonna,
my
we're gonna
children.
do the blood vessel, and then what we're doing is basically changing the wavelength, okay, so that different pigments will be basically pulverized by different wavelengths.
Okay.
So black is different than red, so he has some residual redness here. So we're going to use a different, basically, frequency of the light source to treat the red. So, and then the green, like I say, it's very, very tough to get a light source that will pulverize
So
the
this green right here has had 5 treatments already.
It actually has. Yeah, and you can see it's very, very resistant.
Okay.
So that's why we're going to do what's called electrodesiccation. That'll be the next step that we're
That
going
sounds
to do.
scary, Joe. I don't know.
No, he'll be numbed up for that. So
We're going to put you to sleep, and we're going to take your arm off from about your elbow down.
It'll probably
You
hurt
mind?
me more than it hurts him.
Oh, geez.
So,
All right, let's do it.
all right, so let's get this red. So the red is over here.
Right
yeah.
here?
Yep, everybody got goggles on? Okay, goggles, good. Okay. Oh yeah, we gotta wait for the beep.
What was your tattoo of?
It was a bear's head.
A bear's head. Okay. You don't like bears anymore? Did you get it when you were very young?
When I was very young, when I was in the Navy.
When you were in the Navy? Okay.
It was a mistake. I should have never got it.
Well,
You know how many times we hear that?
You don't make mistakes.
Lots of times. Lots of times.
now what was that you just did? Because it looks different than the other.
Well, it's different pigment.
Okay.
Okay. But now the green, that we're going to do differently. So I'm going to numb that up. We'll come back in a short instant, and I'll show you what I'm going to do for that
All
green.
right.
We're going to do a test area with the green.
Okay. So part 2 of the laser removal for the tattoo is we had to numb Joe's arm.
Right. Correct.
And this is more extensive, correct? 'Cause
Right.
it's
Well,
green.
actually, what we did is we're going to do a little test area for this green, okay? Because as we mentioned, green is very, very difficult to get out with the laser. So what we're using is this electric instrument, and Joe is numbed up this area, and we're going to kind of pulverize the pigment with this what's called an electrodesiccator, which you'll be able to see. Now, the pigment will be actually more pronounced when we do this because we're removing the top layer of skin. And when I peel this off, there.
Joe, you good?
So
Alright.
that, and then we just remove the top layer of skin with this instrument.
Wow, look at that.
And what we're doing is leaving that pigment exposed to the air. And then we'll hit it. And you can see it actually looks darker
Right.
or more intense than the surrounding skin, okay, because we took off the top layer. And then we pulverize it some more. And we just cover it. And we're doing this as a test area because unlike the laser, using this procedure, you're more prone to get a little scarring there. But of course, it's going to look better than having this bright green.
So he's numb,
But we
and
want
you're
to
okay.
see.
I'm okay.
Yeah, he's fine. Yeah, he's fine. It's numbed up.
I think I need numbing medicine to look at this.
Yeah, Jeannine's pretty queasy today. But and then we're going to cover it. Joe, you want to keep this covered for the next few days? Okay,
Okay.
real important. We'll tell you which ointment to use, and then we're going to see how this responds over the next few weeks.
All right.
Okay, and hopefully this will gradually fade or even fade markedly following this procedure.
So think before you get the tattoo, and if you want it removed, it does take a couple of times here to
And
get
sometimes it can take more than a couple of times. It can take 10 or 12 times to do it with the laser.
All right.
Whereas this is usually quicker, but there's a greater chance of getting like pigmentary changes and whatever. So when you can, you'd rather do the laser, but when you get these resistant colors, I mean, Joe has had this green treated several times and it just doesn't budge. So this is plan B.
All right. When we come back, another use for the laser is to remove some blood vessels, right?
Absolutely.
Okay, we're
Namely
gonna-
from you.
I know. So I'm going to be the guinea pig, I guess.
Followed
Stay with us.
followed by a brain transplant.
I would love that. Stay with us on Skin Sense. So welcome back. back. If you're just joining us here on Skin Sense, we're talking about laser procedures, and we did the laser procedure on a tattoo. Again, if you're looking to get a tattoo, first, be sure that you want one. Secondly, green is the hardest color to get rid of, which we saw earlier in the program.
Yep.
So laser can be used on different things, right?
Yeah.
And?
Usually human beings, but in this case, we're going to make an exception.
For me, an
yeah,
alien.
For you. Yeah, of course.
Okay. And we're talking about, I mean, I have like just a minor break in a blood vessel underneath my eye. It has grown over the years, some broken like capillaries. And like I said, when I was pregnant with my daughter, I had a lot of extreme vomiting issues from being sick. See what women go through?
Yeah, I see, yeah.
But anyway,
Yeah.
These are things that they do continue to get bigger. And I know at this point, some people say you have something underneath your eye. So it's really cosmetic. But again, this is something that if you're interested in getting done, you can have it removed, right? And see pretty good results.
Absolutely. That's the best way to remove these things. Really the only real way to remove them was a laser. And she has what's called the hemangioma, which is just
Hemangioma.
It's just really a blood vessel that reached the surface. But she also has, under her nose, these very, very fine capillaries, okay? And we see that with something called rosacea, okay? So, and we're going to treat both. We use different settings, same laser, different settings. And Jeannine said she's very nervous. Are you still nervous?
Yeah, I'm going to cry, but Ray said it's going to be okay.
Yeah,
Ray's
it's going to be okay.
Our guy with the laser, he actually does the settings, right?
He's also a psychotherapist, so we brought him in especially for
you.
Oh yeah, for me. Yeah.
For you all the time, but for me today.
Yeah.
All right, so I need to put on these special goggles, right? And
yes, you need to
what's
put
the
these
importance
goggles
of these?
because you have to protect the eyes from the laser.
Okay.
Okay, that's really, really, and we all have to wear goggles. So,
so if
we
it
will do
hurts
that.
and I scream really loud and start crying, we're just going to have to take a break. How about that?
And if she starts vomiting, we're really in trouble.
If I start vomiting, if my face, if I grow another eye during
move
this.
those around so they're less uncomfortable. Please keep your eyes closed even though you have those on.
Okay. Do you want me to sit down or lay down or?
Let me see if we're going to be able, how we're going to be able to get to that. What I'll do, doctor, is I'll kind of pull that away for you, and then what we'll also do is use a shield.
Okay, so tell me when this is happening.
We'll tell you.
can't
It's
see
going to be
now.
a flash of light. Okay, so.
Oh my God. It didn't hurt, it just shocked me.
That's beautiful. It's beautiful.
That's it.
Yeah.
That's it?
Yeah, that's it. yeah. See,
Knock that right out.
It
You see
wasn't,
how
I
easy
swear
this
it
is
wasn't
to
that.
do.
It shocked you though.
I know.
Like
It's
you
just
see a
this
flash
big
of light,
flash
like
of
I'm going
light.
to heaven right now.
But then if you look, you can see a little bruising there, which is what you want. And the bruise lasts about a week or so.
Okay.
You can certainly cover it up.
Can I tell
but
everyone that you pinched me?
Not me.
in the eyeball?
But, oh yeah, in the eyeball maybe, yeah.
Okay.
Otherwise your husband will be coming after me. So, and then next we're going to do the little vessels under the nose.
Now, is it these are like very sensitive areas too?
Yeah,
right?
it's a little sensitive, but we know you can take it.
Okay, just let me know when.
Hey,
It's very scary to have these.
if you had kids, believe me, you can definitely do the laser.
Good job, Ray.
Thank you.
Keep you around.
All right, now what we're going to do is she's got this little area under here, flash of light.
It
There.
doesn't hurt. It just shocks you.
Yeah, it's there. This is a low setting. There's one in the nose that's going to feel there. And I'll scoot around and we'll do this side over here. And here. And here. And here. And
That is so
it.
neat.
Yeah, that's it.
It didn't hurt at all.
No, no. And then we can take your goggles off.
Am I
So-
bleeding?
No, you're not bleeding. She does not require a transfusion.
I thought I was getting a brain transfusion too today.
That's later.
All right, later.
Okay, we're not gonna film that.
Wow.
It's not FDA approved yet.
Okay, so it obviously it is safe to do near the eye.
Well, yes.
I
mean,
hope
you just
it
have
is.
to be.
Should have asked that
no,
before
you just
we
have
did
to
it,
protect.
right?
That's what we have the goggles for.
Okay.
And like I say, you can see a little bruise here, which is exactly what you want. If the blood vessel doesn't go away totally after the first treatment, we just treat it again. You see how easy it is.
And this
That's
you do on
basically-
rosacea. which
Yeah, we do this on rosacea, and you painless, right?
Right.
It's painless. So for those of you with rosacea who have the bright red faces, this is the best way of treating it. And you know, Jeannine's a chicken, and she tells you it's painless, so that means it's really painless.
And I'm honest, because if it hurt,
Yeah.
you would see me
Yeah,
crying.
yeah, she did great. So, and that's one of the main reasons why we use the lasers for these blood vessels.
Now, for something like this, we talked about the laser on the tattoos. You needed several treatments. For something like this, do you need further
Right.
treatment, or do you have to? Is everyone different?
Usually, when somebody gets bruised like that, that should be the end of it. Some people, when we treat rosacea, they'd rather do it more gradually and not get bruised, and then you might need 2 or 3 treatments. Or if you want to get bruised initially, maybe just 1 treatment.
Okay.
Okay, and you'll be bruised for, by bruise we mean little tiny pinpoint little bruises.
Right.
You'll be bruised for about a week to 10 days. Very easy to cover it up. But that's if you want, the more bruising, the better results.
All right, bruise it up.
Yeah.
All right, so again, these laser treatments, if they want any information, they could certainly contact you or your office. I know some of you have reached out to me on my Facebook, Jeannine SSPTV, which is fine, and I could give you the information, or you can also contact Dr. Schleicher. You are here at the Hazleton location.
That is correct.
And
Yep.
the phone number?
The phone number here is 459-0029.
Area code 570.
Right, correct.
Ray, thank you so
Right.
much for,
Couldn't have done it without Ray.
yeah. Couldn't have done it without Ray. He made it painless.
No.
He
So,
probably would have made it painful.
I'm replaceable, but Ray, forget it.
Forget
We're
it.
gonna
Keep
have
Ray. He might be
We
hosting
need,
the show
we
next
need
time.
this $100,000 laser here, so
Right.
perfect.
Awesome. Well, thank you
So,
for having us.
yeah.
Again, if you have any questions or if there is a show idea you want us to do, you know, I'm normally the guinea pig, but we are looking for people out there to be on the show for our procedures. You can call me or you can call Doctor. And thanks for joining us here on Skin Sense. We'll see you next time.